In 1987, the year NAT was established, there were around 1,000 people diagnosed with HIV. 25 years on, in 2012, we're now almost reaching 100,000 people living with HIV. The challenges we face in tackling HIV in the UK may have changed and evolved, but they certainly haven't gone away.
You had people dying, young men particularly dying in wards, nurses, I mean really in tears because they couldn't actually produce any cure. There was a lot of fear. People didn't understand what was actually taking place, and they just feared that it was going to be infectious.
There was also a kind of very moralistic tone as well, in that because there was at the time no sort of real understanding of HIV, people were saying, well, it's God's punishment for homosexuality or for promiscuity. The logic of that is that if somebody had HIV, then they deserved to get it, and if they had AIDS, they deserved to die. 1987 was when the government launched its first major public education campaign on HIV.
If you ignore AIDS, it could be the death of you. So don't die of ignorance.
I mean, the Don't Die of Ignorance campaign was controversial. I mean, quite a lot of people said we were overstating it, we were overdoing it. The fact is that we didn't have any drugs, and there was nothing that you could do. So the only thing you could do was public education.
Princess Diana was instrumental in raising awareness and changing public attitudes towards HIV. In 1987, she opened the first HIV ward here in the UK, and the photograph of her holding hands with a man with AIDS was beamed all over the world.
And that had a huge effect on public perceptions, in that it reassured people that you couldn't get HIV or AIDS just by shaking hands with somebody.
Since Diana's untimely death, no one in the public eye has stepped into her shoes in terms of speaking out and raising awareness of HIV in the UK. Over the last 10 years, we've tracked public awareness and attitudes of HIV through Ipsos Mori surveys. And unfortunately, what the results have shown is there's been a gradual decline in knowledge over the last decade.
We need to do more in terms of public education. We still do need to tell people the facts.
When I was diagnosed, there was nothing, absolutely nothing. That was in 1984, right at the beginning of the epidemic. And then in 1996, effective treatment became available, and that meant you had to be treated with a number of different types of drug to hit the virus in slightly different ways. And that meant that you could be taking several different types of drugs, several different types of day. Sometimes they had to be taken with food, some had to be taken without food, and somebody said this was actually the most complicated medical regime in history that anybody had to take. Since then, since 1996, it has become simpler.
Really, I'm fitter now than I've ever been. I'm kind of healthier, really. I've got a full-time job. I go to the gym 3 times a week. I have a busy weekend. Okay, I take 3 pills a day, but that's hardly a burden.
With access to and careful use of treatment, people living with HIV can live very long lives. Probably have a life expectancy similar to that of an HIV-negative person, which just means that now people living with HIV can continue having healthy and fulfilling relationships, they can continue working, they can go back to school, and they can have families if that's what they choose to do.
HIV is a life-changing experience, but I'm one of the lucky ones because HIV has always given me more than it took away. So since my diagnosis, I can't think of any way that my life's changed negatively, and practically, I've got married, I've bought a house, I've changed jobs, I've done the things that I wanted, so it's all positive for me.
NAT has worked tirelessly to educate journalists about HIV and to improve the standard of HIV reporting.
It's quite common still to get really completely inaccurate and quite inflammatory reports and articles about HIV in various newspapers. So those need to be challenged, those misconceptions need to be spoken out against. When I see NAT responding to something completely wrong in a newspaper, for example, I'm really pleased that they're doing that. It's important that they're doing that.
I think if I want information about things like the law or confidentiality in the healthcare setting or my rights, then NAT would be the first place that I would look, and it'd be the first place that I would advocate others to look.
Understanding issues such as the benefit system, your rights around employment, the equality law can be quite complex for your everyday person. And so it's great to have NAT who take those very complex issues and actually explain them in language that people can understand, and therefore enable them to navigate the system even better.
Despite all that we have achieved, tackling stigma is one of the areas where we just simply haven't made enough progress.
The sense that HIV in some way justifies treating people differently or discriminating against them, that's still there. It's very deep-rooted.
I've had some real direct experiences of stigma myself in relation to my HIV status. And that's usually around the situation of trying to find a partner.
What's surprising when you come to think about where I've actually been stigmatised or faced discrimination is it's, on both accounts, it's been in the healthcare setting, outside of the HIV clinic, in the hospital. So I can tell you with my dentist in Birmingham, I had an examination where the dentist did my examination at arm's length and the whole room was kind of covered in plastic. I luckily asked to see another dentist, and thankfully she has no problem.
If I disclose my status to somebody and they don't like it, then I think, well, that's your issue. I mean, they don't pay my bills, they don't feed me, they don't educate my child, they don't clothe me. So if they don't like me simply because I'm living with HIV, then that's their problem.
I think because HIV affects stigmatised minorities, it isn't a kind of a popular cause. And so you need organisations like NAT which think very hard about the well-being of people with HIV. Because the well-being isn't just about treating people, it's about dealing with all the social issues that people with HIV face. I think NAT's work in that is absolutely invaluable.
NAT continues to tackle sensitive and challenging issues on behalf of people with HIV, and we simply don't give up.
I think NAT's had a tremendous first 25 years, and I think it's going to have to go on, and it should go on, and I look forward to it going on.
I think NAT's work is still important to people like me who are living with HIV because they fight my corner, they stick up for me. And government listens, and that's important. Government wouldn't listen to me, but it would listen to NAT. So it's reassuring that there's an organisation there that I can rely on when I need them. And perhaps if NAT weren't there, I'd feel a little bit lost, a little bit vulnerable. So I'm pleased they're there.
You've done a lot of work so far, but I think we need to carry on doing even better work and ensuring that the future generations will have less and less to actually have to fight about.
I think it's important that we use whatever mechanisms we can to have our voices heard, and I think NAT has offered us many such avenues: the press gang, the activist network, contributing through Facebook, Twitter, really feeling part of something. It's a powerful way to make people living with HIV feel meaning in their diagnosis, to feel less disenfranchised and to feel a little bit less isolated.
As a society, we're a long way from getting our response to AIDS and HIV right. And I think the need for NAT is as great, if not greater, than it ever was.
Without their help. And without the help of the voluntary organisations, we would not have made the progress in this country that we have done. The NAT over the years, I think, has been worth its weight in gold.
Shaping attitudes.
Challenging injustice.
Changing lives.